even just being able to get any coverage whatsoever. I have patients who are so poor that they have to choose between getting their medicine and eating. Okay. I had a patient die at home not that long ago, and they brought me the death certificate to sign. So I wrote his medical conditions, and as a reason for, as a contributing factor to his death, I wrote no health insurance. About a week later, I got a call from the state medical examiner's office, and the medical examiner person said, well, you wrote no health insurance as a cause of death. I said, that's why the patient died, because I knew what the patient needed. When the patient had his meds, he was compensated. His heart failure was controlled. His diabetes was controlled. Okay? But he had no money, and he couldn't afford his meds, and he couldn't qualify for anything. Okay? And because when he was on his meds, he wasn't disabled. Okay? So, and he was in his 50s. He died at home. So the lady at the medical examiner's office says, well, I said, well, that's why he died. We know how to take care of him. When he was on his meds, he was compensated. He was functioning. And she said, well, you can write that in the record, but you can't put it on the death certificate. I said, why not? That's the reason he died. And she finally said, you're not going to take this off the death certificate, are you? I said, no, I'm not. And she left me alone. Because I wasn't going to do it over again and take that off and just stick it in the record. I want people to know that people die because they don't have insurance. And I see those patients all the time. I can't even bear to go to my clinic every single day of the week. I go Monday, Wednesday, Friday. It's too, wears me down.
So what about people, do you deal with a lot of people who do have coverage?
Yes, I deal with a lot of people who have coverage. Most of the time they're the Medicaid type plans. With those plans, there are whole classes of medications I know I can't get for my patients unless I beg, write, and spend hours faxing records and talking to people, and then they say, well, we'll tell you in a week, and then I get a letter denied. It's like very exhausting. It's very, very exhausting when people are underinsured as well. But at least I can usually get something when the patients are insured.
Yeah, so when you're talking to your patients now, do you mention what's going on?
Oh yes, and I tell them to get active and because it's ridiculous. I'm a rheumatologist as well as an internal medicine doc, and I saw a patient recently who had a rheumatologic condition. He was a young man, and this is a very disabling, progressive condition. And he finally got new insurance. I mean, he was horribly disabled. Got new insurance so he could get something. But they told him for 10 months it would exclude his quote, prior. This is the major thing that's wrong with the guy. And so for 10 months he has to pay out of pocket. It's a good thing he responds to a relatively inexpensive drug. But if he didn't, I would be SOL. Some of the other medications used for this condition cost in excess of $14,000 a year. But that $14,000 a year makes a difference between total disability and total functioning. Okay? So it's a no-brainer. It's indicated. Luckily, he responds to something a little bit less. And luckily, the insurance company hasn't figured out that some of his other organ systems that are affected, namely his eyes, are part of the same sin. They didn't figure that out, so they're paying for his eyes. It's part of the same condition. This condition affects a lot of parts of the body, not just the joints. So
when you're talking to neighbors about this, and maybe somebody who has coverage,
people are very tired of listening to me because I do get passionate about it.
Mm-hmm. And do they have a lot of questions about it? What kind of responses do you get from people outside of your line of work?
Well, most people are sympathetic. They understand that they say the system is broken. I say, what system? We don't have a system, okay? What I call our system is SSSS. We have Sick Services for Sale system. That's what we have. Sick Services for Sale. We don't have a health care system. And if people believe that insurance companies want to pay for health care, guess what they call it when they have to pay a medical bill? The insurance industry calls it medical loss. They want to minimize their medical loss ratio. That means they don't want to pay the bill. Okay. You know how they've gamed the system? Half of the coding pieces, we use a system called ICD-9, International Classification, used to be Classification of Death, it's now Classification of Disease. Half of those codes are what they call invalid for billing. What does that mean? Does that mean that because a patient has asthma, they don't have asthma? They won't pay the bill if I put the asthma code on the bill. They'll send it back because they've decided that that code is, quote, invalid for billing. What makes it invalid? We allow them to get away with that.
So what,
and if they send the bill back, they know that only 50% of them come back again. So they use any excuse. If I put any of the, quote, invalid codes, I can have the valid code for, quote, valid code for diabetes, hypertension. If I put that asthma code on there, they'll send the bill back. Even though it wasn't really part of the main problem. They won't pay for the 2 other conditions, no. They send the bill back, because that's their excuse to send the bill back. Any excuse to send the bill back, and they know they only get half of those back. We have conferences in this country dedicated to denial management, and we all pay for that.
So if there are things, this legislation right now that's being debated, it's going to change, and what are some of the things that you absolutely need to see passed in this reform?
Well, I understand the political climate will not allow us to do what makes most sense, which is single payer. Absolutely, positively, it makes most sense. It makes most financial sense, and it makes most medical sense. However, I know we can't do that in one go. No, we can't pass. So, I just want to see in my practicing lifetime an ability to get reasonable insurance for everybody I see. I know we'll have to still deal with insurance and all the vagaries of the insurance industry that, just wants the money for themselves and not to pay the bill, but maybe we can get a little progress toward actually getting people reasonable coverage. Instead of having people get coverage any way they can. I had a rheumatoid arthritis patient who was totally disabled when I first saw her, and she was on disability, okay? I created a mess for her by getting her well, because then she was no longer disabled. She lost her coverage. What? How is that taking care of anybody? People have such secondary gain. I see many people with a lot of secondary gain to stay disabled. It's the only way they can keep their health care insurance, especially here in Maryland with Medicaid. You have to say a patient's disabled. I have to swear that the patient's disabled.
So when you're when you're talking to neighbors or maybe family members about this, and they say, "Well, my insurance is okay. It's not great, but it's okay. It doesn't cost me a ton of money right now."
But you see, a lot of the hidden costs are the entire profit-driven healthcare system we have. Okay, there was a study done looking at the cost of and this was published in the medical literature about a year ago, maybe a year and a half. They looked at the cost in Canada of a bypass operation. Okay. And in a similar person, in a similar size hospital, in a similar case mix hospital, all the same things, they looked, and they excluded doctor fees. Okay? They excluded physician fees. The same operation